Hi everyone, my name is Monica Blanton-Verzer and I'm going to talk about bone and joint health today. I may have to split this lecture up. My iPhone only lets me do so many minutes at a time, so you might have to cut them up. I actually am a physician assistant and I've been a PA for almost 18 years, and I've also been in the Great Plains Alliance for the last couple of years. I started in January of 2013 getting my master's in gerontology. And the reason I started that is when I went to PA school 20 years ago, it was still a bachelor's degree program, and now it has advanced to a master's degree program, and the nurse practitioners are now getting their doctors in nursing practice. Physical therapists are now getting DPTs as our occupational therapists. So everybody's moving up, and I've always felt I needed to get my master's degree to be on par with everyone else. So I've been working on my master's in gerontology. And the reason I chose that is for the first 6 years of my practice, I did primary care with family practice, internal medicine, and some urgent care. And I did treat osteoporosis at that time. And back then, the bisphosphonates for osteoporosis were brand new drugs, and they were considered to be these miracle drugs. We had come up with these great bone building drugs. We were so excited about them. And actually, since then, life has changed a little bit, and they're not quite the answer we thought they were. But about 11 years ago, I changed and went into orthopedic surgery. And with that, I treat a lot of osteoporosis in the standpoint of hip fractures and wrist fractures. I sometimes see vertebral fractures, but those don't always need surgery by any means. They rarely need surgery, if anything. But also, I've done total joint replacement over the last 11 years, and that includes hip and knee replacement. I also worked some with a shoulder replacement. I've imagined somewhere I've done around 2,000 to 3,000 knee replacements, over 1,000 hip replacements, not including hip fractures. And so that has kept me very busy over the last 11 years. And so I see a lot of arthritis. It was the major point of my practice. And then I saw a lot of spine with that as well, spine arthritis. And we didn't treat it surgically, but we did treat it medically. Last year, I left that job to try and help start a physician assistant program that unfortunately was unsuccessful. So in December, I started working for a neurosurgeon in Topeka, and now my practice is 75% spine surgery and 25% brain surgery, which is really cool and amazing. And I have to say, I've always felt fortunate to be a physician assistant. I started on this road thinking I was going to go to med school. I somehow took a detour and went to PA school, and it's always been a remarkable journey for me, and what I get to do to help with patients and the surgeries that I get to do, it's just really quite amazing. I love being in the OR, and it's an awesome experience if you've never been in there to actually make a difference. So I'm going to talk a little bit about my lecture here. We're going to start with osteoarthritis. And osteoarthritis is incredibly common. It's like the third most common chronic illness and the most common cause of disability. One Australian study found osteoarthritis in the knee is the most common at 21%, spine at 13%, and hip at 7%. Hands are greatly involved too. You'll see old people that have these gnarly fingers. But hands are usually pretty tolerated. People can deal with those fingers deformities. Hips and knees are what tend to get replaced because they are our weight-bearing joints. We have to walk. Osteoarthritis is expected to cost 1 to 5% of the gross domestic product of developing countries. It's very expensive because this is a common problem. As we all get older, we're going to get more arthritis. My patients ask me all the time, what causes arthritis? And my number one answer to that is birthdays. If you live long enough, your joints are going to wear out. Some joint is going to wear out. It's a moving part. It's a mobile bearing joint. It's going to wear out at some point. Chondrocytes, which are cartilage cells, are quite fragile and damage easily. So they don't repair themselves, and they don't have a lot of blood supply. So once you had an injury, especially knee injuries, which we see all the time in athletics, you end up having knee arthritis. By 2030, the demand for joint replacement procedures in the United States is expected to grow by 174% for hip replacements to 572,000 and 673% for knee replacements to 3.48 million procedures. We're all going to need our knee replacements is what this sounds like. And the reason the AAOS, the American Academy of Orthopedic Surgery, put this out is they're actually concerned that there won't be enough orthopedic surgeons to be able to do these procedures. Most orthopedic surgeons these days are coming out of residency and they want to go into something that's very family friendly, like sports medicine, where you don't have a lot of inpatient, and they don't want to do joint replacements. Joint replacements take a lot more time. The patients are in the hospital longer. They require a lot more care, and it's not the cush life that a sports medicine doctor has. So we're going to run into a situation where we just don't have enough orthopedic surgeons to do all these. So that's a concern for the American Academy of Orthopedic Surgery. Causes of osteoarthritis: mechanical wear and tear. I tell my patients that cartilage is like the tread on your tires. When you drive around long enough, you burn off all the tread and you're left with bald tires. And that's what arthritis is. You lose all the cartilage within the joint. So the number one cause is just mechanical wear. You've used it a lot, you've worn it out over time. Trauma. If you've had a major injury to a joint, studies have shown if you have an ACL ligament tear and have an ACL reconstruction, within 10 years you'll get arthritis in the joint, no matter what happens. As many as 50% of people with meniscal injuries, which are the brake pad type cartilages within a knee, will have osteoarthritis within 10 years. It just happens. Cartilage is a very friable, fragile substance, and if you injure it, it's going to come back to haunt you. Infection. Joint infections aren't common. Kids can get them. They can seed them from other infections in their body, or they can be seeded into the joint. Your handout talks about injections into the knee will sometimes cause infections. That's incredibly rare. I've never seen that in clinical practice. So I don't when I stick a needle in a joint, I never worry about infection. It just doesn't, very rare. It's so rare, it just never happens. But if you do get an infection in a joint, the bacteria actually eat away at the cartilage, and that results in arthritis. Altered body mechanics: if you're born with some kind of congenital hip dysplasia or cerebral palsy that sets off your joint so it's not quite the normal angle, it doesn't work right, it's going to wear that joint out faster. Congenital joint abnormalities, same thing. Metabolic syndromes, gout and chondrocalcinosis, pseudogout are things that kind of eat away at cartilage. And genetics: if it runs in your family, you're more likely to get it. It's just the way it is. We actually, studies have shown that dinosaurs showed arthritis in their joints, so it explains why they were always standing in the water to help take the weight off. Body mass index: most closely associated with osteoarthritis of the knee, which is a major weight-bearing joint. And, you know, people with major BMIs don't tend to wear out their joint by use because they're not moving so much. There's some thought that not using the joint and sitting around actually creates an inflammatory process that helps eat away at the cartilage. But also the amount of weight is just way too much. When we do joint replacements, we'll get in and find this frame of this person is built for 110 pounds and they're carrying 230 pounds. Our bones are not built for that. Our joints are not built for that. We were not meant to be that heavy. And when you put that amount of stress through a joint, it's going to wear it out faster. One thing I think about too is that as you mobilize yourself as you get older, we don't get stronger as we get older, we get weaker. So here you are trying to push yourself up out of a chair and walk and get to your mailbox. That's a lot easier to do when you're lighter than when you're carrying 50 to 100 extra pounds. How do you push yourself up out of a chair? How do you have the strength to do that? Obesity is going to be a major issue in this country over the next 20 to 50 years. It's taking over from diabetes, and that's really concerning for all of us. But so body mass index is a huge thing. Whatever we can do to improve people to get their weight